Welcome to the Change of Him podcast. My name is Gerard Uselli, and we are on episode 61. But here is a little twist for you. For the next 10 episodes, we're going to be covering amazing essential workers who have really set the pace as far as handling the COVID-19 pandemic and how they've gotten themselves through it in a mental way, physical, and emotional as well. So this next guest is a very good friend of mine, a doctor who practices internal medicine, Marc Fafalak. Marc, how are you today?
Good, doing well, Jerry. How are you doing?
I'm doing great. So to get right into the questions, here's how we're going to remix it a little bit. So instead of asking my typical, what was your childhood like growing up? I'm going to start with this as my first question for all of my guests relating to your role. Did
Mhm.
you always know that you wanted to be a doctor?
Yes, I did. Yes and no. So my father's a doctor, so I kind of grew up with being in the medicine field, hearing about it, going with him on rounds, and kind of using that as uh, an inspiration for what I wanted to do. But I knew that, that being said, having wanted to be a doctor for my whole life, I wanted to make sure that I wasn't just rushing into something and that I didn't have, interests in anything else. So a funny story actually is in college when I was choosing my major, I wanted to figure out if medicine was really 100% where I wanted to go. So I also had, interest in physics, in the physics of flight. So I was like, okay, well, aerospace engineering. Do I want to be some sort of engineer or something like that? So I'm looking through engineering jobs, and I realized, engineers physics, you have to do a lot of math. So like I'm real good on the biology stuff, math not so great. So I decided that going to medical school was actually a little bit easier than having to do math so much. So at that point, I was like, all right, well, that's the only thing that I could have wanted. I'll go to medical school, and I'm glad I made that decision.
Now, here's an interesting question, maybe following your father's footsteps or not. So, was he good at math himself, or kind of like in the same bracket in that regard?
It's a good question. I actually don't really know. I mean, he's really great. Like he could do math in his head, which I'll be honest with you, I still count on my fingers. But he's I think he was good at it. So he was more well rounded than I am.
There we go. Very humble answer to say the least. So, my next question, kind of leading into what you do today, is what does practicing internal medicine mean to you?
It's going to sound cliche, but it's for me personally, it's about helping people. So in medicine, a lot of people are thinking, okay, doctor, he's rich, he makes a lot of money. The issue is with modern medicine that doesn't happen so much anymore. With Medicare, Medicaid, insurances, things have changed. So it's not really about the money anymore. It can't be about the money because if you go into it thinking about the money, you're going to be disappointed because there's I'm not going to be a pauper. I'm going to be I make a good salary, but it's not as much as you used to in the heyday of medicine. So it's about helping people. It was always about helping people. Just being able to make a positive difference in another person's life by being the person who has the knowledge and the ability to comfort them in literally the worst day of their life is why I do the job.
Absolutely. And kind of leading into that, especially with having such a variety of different patients that you probably deal with, and especially in the sense of you catering yourself to how people's health is currently at the state of their lives. Describe the importance of collaboration when you're monitoring the health of your patients.
Sure. Collaboration is essential. Not to play off of the name of the series, but it's an essential portion of my job. So with modern medicine, there's so many moving parts. There's so many different pieces of the puzzle. Instead of being the doctor, the new way of thinking about medicine is you have not just a single doctor, but you have an entire care team, and it's a team of people. It's the attending physician who's kind of the leader. Then you have anybody in training, any residents, medical students. Those are all essential parts of the team. Then you have nurses, you have support staff, phlebotomists that draw blood, you have, everybody in the front desk and everybody else who I'm sure I'm forgetting. And it's essential to make sure that everybody is on the same page with the patient. So collaboration, sitting down with colleagues, whether they be other doctors or nurses or PAs or whoever else has contact with the patient, you need to make sure that everybody knows the same amount of information so that you can all work together to create the greatest outcome for that patient.
Here's something that I want to also add, especially kind of like as a one-off question. When it comes to delivering news that isn't as convenient for patients, how do you still try to embrace the aspects of having your glass half full when you're relating news to people that you work with?
You mean news to other colleagues or news to the patients?
Patients.
Patients. Okay. Um, it's very hard. I'm not gonna say it's an easy task. Some people are better at it than others. We actually get a fair amount of training in medical school to kind of a way to deliver that sort of news. And they say, okay, make sure that you're with the patient in a room, not over the phone. Make sure that you have, you ask if a patient's family member wants to be there as emotional support. You make sure that the patient is prepared for bad news, essentially to prime them for the situation. That's the training. When you're actually doing it in medicine, that all kind of goes out the window. I mean, it's great to have that if you're in an outpatient office, but a lot of my experience with those sort of conversations have been in the ICU, in the intensive care unit with very, very sick people, even before the pandemic. And you have to get a sense for the person you're talking to, whether it be the patient themselves or family members. It's hard to describe, but you kind of get to know these people on a human level as you're talking to them. So I mainly, in my experience, have talked to family members of individuals who were, gravely ill, terminally ill. We call, our term is actively dying. They're actively at the end of their life, and there are some family members that you have to be very careful with because they're emotionally fragile, understandably. And then there are other family members that are like, hey, doc, just don't beat around the bush. Tell me straight up, 100% straightforward what the situation is going to be. So you need to feel that out on the fly and try and alter the way that you deliver the news in a way that would be both direct enough that it comes across clearly. Because if you try and beat around the bush and you try and sugarcoat it, sometimes the point doesn't get there. I do try and keep that glass half full, but I also pride myself on my ability to not give false hope. Because the only thing worse than delivering bad news is to say, oh well, maybe they'll get better when based off of your training that they're not going to get better. So while I try and keep the glass half full as much as I can by offering alternatives, or if they want to have statistics on survival rates or something like that, to have those ready in case they ask for that. But I prioritize being direct over everything else, and by direct I don't mean in a rude way or in an insensitive way, but leave nothing to be misunderstood because I don't want to string these people along.
I think the ultimate battle is the fight for delivering the right information over everything else, based on what you're saying. Because even if you are as clear and transparent in something, and maybe that could or could not rub people the wrong way, it also defines that importance as far as, okay, whatever that news is, I'm glad he at least communicated it to me clearly.
Yeah, and you need to set it up in a way that primes the family to know this is serious. So there's a specific room in the hospital that I had worked in where you essentially, that's the room for delivering this news. So you take them in the room, you shut the doors, you sit everybody down, you make sure it's quiet, and you turn your phone off, you take your pager, you throw it out the window, and you sit down and you be with the people in the moment. And by doing that and by shutting everything out and by really being present, it lets the people know, oh, okay, this is not a hallway conversation. This is something else that's going on. this is something a little bit more serious that's being discussed.
Absolutely. And also kind of relating this more to yourself as a person, how does your personality embrace the role that you're in? Like what type of traits of yourself kind of speak to other people when you're working with them? And this could be both for colleagues and patients.
Sure. I, you know, I wouldn't call myself a social person. I am a bit of an introvert, as being, I think a lot of doctors are that way, but I have, I was blessed with the ability to kind of be able to socialize with people and uh, to smooth situations over. Because a lot of medicine is putting out fires, I like to call them. There's fiasco, someone's upset, or a physician's upset at another physician, or a family member, or a patient is upset because they think they got slighted or wronged or forgotten about in some respect. And you have to have the personality trait of being patient and being able to also see things from another person's point of view. Because like I had said in the beginning of the session, you're there at the worst time in their lives. They're not going to be nice to you on the worst day of their life. They're not going to be nice to you when they're in like 11 out of 10 pain and scared because they don't know what's going on, or they think someone forgot about them and they're not being treated to 100% of their ability. So there's definitely points in time where I've been screamed at, had stuff thrown at me, or like been yelled at. And you have to have the ability to step back and say, hold on, this is not about me. This is not personal, but this is, you have to see it from their perspective. This is what they think, or this is, sometimes it's due to lack of understanding that they don't really know what's going on. You have to be able to scale that back. So, I have that personality of being able to deal with those situations and being able to, quote unquote, put out the fires. But, also you have to, as a physician, you have to be able to deal with the not so great stuff too. Cause like there's a lot of, to be frank, there's a lot of messed up stuff. There's a lot of
Absolutely.
messed up stuff that you see, whether it be, poverty, or homeless people, or people that are abused, people that have had worse stuff done to them. You just seeing a dead body, seeing a dead body for the first time, you have to have a certain amount of mental fortitude to be able to combat that. And I'm lucky enough that I have a little bit more than I think some of my other colleagues do. I was much more at home and comfortable in the ICU, in critical care, in speaking about those end of life issues and dealing with messed up stuff than some of my colleagues were. Because especially during going into the pandemic and when that all started, some of them could not handle it. Some of them are just not cut out for it, and that's fine. And they're in areas of medicine that will allow them to, still render good care while not having to deal with that stuff. But I'm blessed with that personality that I can handle it.
Absolutely. And adding to the point of the pandemic as well, what was the biggest change you had to get used to on a professional level?
Um, I had to have a lot more awareness. Kind of two things. The first thing was awareness of yourself. Where are your hands? Have you cleaned your hands? Is your mask on? Is your mask on correctly? What patient am I going into? Are they positive? Are they suspected? Are they negative? Am I wearing my eye protection? Am I wearing my, breathing protection? Am I wearing my hand protection? Where am I placing my legs? Because if you have a patient that coughs into their hand, puts it on the bed, and you rub your pant leg against the bed, and then touch your pant leg, touch your face, you can inoculate yourself. So the first big change was being hyper aware of where my body is, what part of my body is clean, what part of my body is not, and being able to keep myself safe in the midst of all that. The second thing that I really had to get used to was on the patient side of things, and mainly patient family. So my personal experience in the pandemic, when we had the first surge, I was, those first 3 weeks of that surge, I was the primary physician overnight in the ICU. So at night, I think I was dealing with up to, I think the maximum was 50 patients that were intubated and sedated at the same time. And our ICU was set up for 16. So
Wow.
we had, again, I'm not good at math, but we had like, over 100, 200% capacity, and it was tight. And in the middle of all that, you also had to consider the patient's families. So normally in those sort of situations, like I had said before, I'd sit down with the family, have a face-to-face conversation, talk to them about the patient's condition, the prognosis, give them a little bit of peace of mind. But during the pandemic, there were no family there, and the only way to communicate with them is through the phone. And I had to get used to not doing those sort of things face to face, not having those conversations face to face, not being able to explain things over the phone without using, drawings or something. Like I always really liked to get out a piece of paper and draw some, little diagrams to help the family and patients figure out and understand what's going on in their bodies or in their family members' bodies. And I wasn't able to do that over the phone. So it was very hard to do that. It was very hard to do that with, 200, 300% of the people that I would normally do it with, and have all those conversations virtually overnight when I'm exhausted and at the end of a 12-hour shift. So that was difficult. And I had to put myself in, the shoes of the family member who was, not be able to see their sick loved one and not be able to be at the bedside.
Yes, and although you've pretty much answered a nice amount of my next question, I wanted to maybe get more of a personalized perspective on it. So, as we all go through the COVID-19 pandemic, of course, there's a tone of melancholy that comes to mind. Whether you've kind of gotten away with not really getting it for the most part or suffering severely from it, how do you think your patients have been handling the pandemic in their own lives? Like, what do you think is like the first couple of things that come to mind with it?
Sure. A lot of it is mental health stuff. That stuff got turned up to 11, amplified a lot. People that were that had mental health issues or anxiety before had it turned up even more. Part of my rotations during the pandemic was on the physician hotline, where I would answer the phone calls and be answering questions about stuff. And in the early days, we didn't know very much. So they were asking questions that we didn't. Oh, how is it transmitted? At that point, we weren't sure. We knew, okay, put masks on, but we didn't know this was before 6 feet. This was before, all those other guidelines that are in place now. So there was a lot of uncertainty. And, I've come to see during my training that uncertainty breeds fear. And a lot of people were scared because it was scary. People have gotten better since then because, especially in New York, as restrictions have lifted, as the mask mandate has become looser and looser, people are getting more back to normal and more back to more back to a regular life. But there are still people that are very concerned, understandably so, but sometimes overly. For instance, I actually had a patient just this past week that had some sort of orthopedic complaint. She had one of her, I think her knees or her hips were hurting, and we wanted to get her to physical therapy to get her stronger and get her better. She was so scared of COVID-19 that she refused to go into any physical therapy place. So we couldn't get her to those physical therapy places. And she was fully vaccinated and she was wearing a mask and she was still scared, which I get it. I saw it from her perspective, but with her sitting at home and doing nothing, her condition is just going to get worse. And I think that's kind of another bit that another effect that the pandemic had that no one really understood, is that when everything went on hold, so did the health of a lot of people. A lot of people with chronic conditions, COPD, lung conditions, diabetes, infected wounds, they weren't able to get out and do anything. And those all got worse during the pandemic. And I think a lot of the morbidity and mortality that we had seen in the pandemic, there's even more that we didn't even count. So my patients are handling it better, but there's a lot of stuff that got a lot harder for them to do. And even now there's a widespread, I don't want to say panic, but fear of everything, fear of going out to some people, even if they're fully vaccinated.
Absolutely. And this is kind of leading to my final question. And also, in a similar bracket to my last 60 episodes, this final question catered to the role of the person I speak to. So, my question to you is, to conclude, how can internal medicine be more essential than it already is?
This is the hardest question of all of them, because I think at the end of the day, my answer is going to be it can't be. Like right now, in this day and age, with this pandemic, medicine is super essential, and I don't think it's ever been more essential, because it's the source of all the information about all this. It's the source of, all of the safety protocols that we're doing, and we need medicine to keep people safe. We need science to keep people safe. I actually saw as a post on Instagram that put it in a really interesting perspective of, we're seeing science in motion right now. This pandemic is the scientific method put on display for everybody. This is, this trial and error, this uncertainty, this, suspicion about vaccines, not vaccines, what's in them, what are they going to do to our life, our us and our children long term. All that uncertainty is how vaccines, medications, everything we use is done now. Like that's how all of these different medications, say like metformin for diabetes. We were at this point with metformin at one point. Metformin's #1 most prescribed diabetes medication in the entire world. And it's, we know the risks of it, but it's a largely safe medication, but we didn't know that when we were just developing it. So while, medicine has always been essential, right now I think it's the most essential that it's ever been, because it's really the driving force that's kind of getting us through all this.
Absolutely. And with that being said, for such a profound interview, that concludes the first episode of the Essential series for the Change Within podcast. For those who want to check us out but have never had the chance to yet, please check out Change Within podcast on Anchor, Instagram, Facebook, and YouTube. Marc, thank you very much for joining me today, and have a great rest of your day.
Thank you. You too, Jerry.
Absolutely. Bye-bye.